Hi, I'm Dr. Jay Hershman, and I am associated with gemsmed.com, and I do ACLS and BLS for anyone that needs it, nurses, doctors, or anyone in the healthcare field. And remember, the American Heart Association does not hire you unless you have these credentials. So it's important to make sure that it's American Heart and not any other company that's trying to get you to do their class, because it's not going to be valid. Okay, so here it is. Who needs the ACLS? And like I say, it's anyone that is in the healthcare field, whether it's basic life support or advanced cardiac life support, which is the BLS and the ACLS. Depending on your level, you will need both or just need one. Usually it's the one is the BLS, and if you need both, it would be the BLS and the ACLS. And I'm going to explain this to you. And who needs both? It's usually the people that are in the hospital setting, nurses that are involved in the emergency room, or people that are involved in the cardiac center would be required to use both BLS and ACLS. And remember, you can't do a good ACLS unless you have a good BLS. It's impossible. When you are in the emergency room and the person's having a heart attack, there's a person doing compressions, there's a person doing the breathing, there's a person doing the medications, and there's a person doing the documentation. And then there's the doctor who's looking at the EKG and dispersing the medications and giving the orders depending on what the situation is. So this is just understanding the procedure of how a code works. And the BLS, well, that's for everyone. It's CPR. A BLS is the so-called one for working in the healthcare field, but CPR should be for everyone. Everyone in working in a cashier, when you're seeing customers walk in, they're having chest pain, they're having shortness of breath, they're having a stroke. This happens all the time. You must understand how to handle yourself and being prepared to keep them alive until the cavalry come, which is the ambulance. So my class expectations, what will you be learning? Well, in the BLS, it's going to be understanding how to approach a patient, how to make sure that you know how to first encounter this patient, whether it's being outside in the streets or in the park, when you're seeing somebody with chest pain, when you're seeing somebody that's unconscious or having trouble breathing or having trouble choking, you have to know how to approach this patient. And I teach you all of that on a clinical level. I'm a doctor of medicine. I know what I'm doing. You'll walk out of my classroom being a whole lot smarter than you were. When you do the BLS, it's all about compressions and breathing. And remember, the compressions are much more important than the breathing. I give you something for your keychain so that you can have something for breathing in case you don't want to touch their lips with your lips. It's important to have some kind of a barrier. So I give you something for that. And it's a little keychain with a little plastic bag in there that will help you with a one-way valve so that you can breathe into this person's mouth without causing any damage to yourself, which is also important. It's all about understanding what we're dealing with when it comes to the heart and the brain, which are the only two organs we're concerned about in the BLS. When it comes to the ACLS, well, then that's a code, and you have to understand the drugs, and that's where I go into the drugs. What are the drugs for, and what do they do for the abnormal heart rhythm or the arrhythmia? There's 100 scenarios. I teach you the drugs that will get into those scenarios. To learn EKGs, well, you have to take a telemetry class to learn EKGs. But I will get into the EKGs a little bit, so you're going to be smarter. Knowing how to read an EKG, knowing to see what is a normal EKG is very important. So if you kind of want to get that interest of knowledge, I'm there for that. And I'll go as far as you want to go with the EKGs, understanding that the abnormal rhythms you need practice. will not learn them in one class. You need to constantly read these strips and know what they mean and know what they are, and you will eventually understand what you're doing. Because remember, I'm only one small class. You need many hours of study to really understand the EKG strips and understand what they mean. And the American heart is exactly what I'm talking about. The American heart is really up to date with all of its understanding of procedure and protocol when it comes to ACLS and BLS and CPR. And no one accepts anything else. Red Cross is trying to get involved in this, and it used to be Red Cross and American Heart, but the American Heart is surpassing Red Cross, and most hospitals only allow American Heart. Your scores you need to pass. Well, you know, no one fails my class. I make sure you pass my class. We go through the exam very methodically. We take every question individually, making sure you understand the exam. The videos are there for you to learn how to approach these scenarios, and it becomes a very complete course. I also have a very good handouts. This is my own thing. American Heart has their handouts, which I give you, but I give you my handouts. That will help you out tremendously in the future of learning and directs you into your pathway as to studying. The BLS protocol, you must learn the CPR. You must learn it. You must learn how to do compressions properly. You must learn how to do breathing properly. And remember, compressions are much more important than breaths. Remember that. So if you can't do breaths, you do compressions, 30 to 2. Well, you won't be doing the breathing, but it's 30, pause, 30, pause, and you have to do that 5 times, times 2 for 2 minutes. And the ACLS protocol, and you have to know codes, and you have to know the emergency situation, and what needs to be shocked, what doesn't need to be shocked. And I go through a basic understanding of why you would need to deal with a shock being unstable, the unstable versus stable. And when people are stable, usually we do not shock. There are certain scenarios where we do shock when they're stable because the situation is so dangerous. But overall, the 90% rule is that there's bradycardia, tachycardia, stable or unstable. And that's the basic concept of the way I teach. Now, I hope this was helpful for you. I'm here to help you. You can call me at 913-515-7925 directly, or you can go to gemsmed.com, JEMSMED.com. You can look at my website. I have free resources there. I have exams there. I have books there. Look at things. Look at my website. And try to understand why I'm here. I'm not here to make you into a doctor, but I'm here to drive you towards that path and think like a doctor. Thank you so much, and have a good day.